welcome viewers once again on today's edition of DTL World Health Talk Show. As we previously brought you DTL Health Talk Show last month, that was on anger. And today we'll be dealing with depression, which is also another CNS, that is central nervous disorder, or another mental disorders, one of the mood disorders. And depression in general, when you talk about depression as a topic, as we'll be bringing you today, basically means depression is a mood disorder that is characterized by feeling of sadness or loss of, loss of hope when you talk about depression. And it is characterized by these two major symptoms. Sometimes it comes along with its own complications and also comes along with its own health implications. When you talk about depression in general, in our part of the world, as for instance in Ghana here, majority of the people don't consider depression as a major mental disorder or a major mood disorder. And depression goes beyond that, as we can see. For instance, in the United States of America, that is spanning from 2013 to 2016, almost 8.1% of the adult population, that is aged between 20 years and over, were estimated to have suffered from depression, which calls for major concern. And I personally believe that depression is a recipe for suicide. Or yes, I would say that depression is a recipe for suicide. And there are so many forms of depression, or basically there are two major types of depression, which I must throw light on. We have major depressive disorder and also persistent depressive disorder. These two major classification, or these two major types, were classified or are classified based on the severity of symptoms. For instance, when you take major depressive disorder is persistent, and like the feeling of sadness, the feeling of hopelessness are persistent, and it lasts over weeks, and the symptoms are persistent. That is why it is called major depressive disorder, and it is severe form of what? Depression. That is why it is called major depressive disorder. It is characterized by, that is, low self-esteem. We also have loss of interest in already pleasurable activities. We also have inability to concentrate or inability to complete a task. That is another form of what? Major depressive disorder. And we come to the persistent depressive disorder. With the persistent depressive disorder, it is the symptoms is very milder as compared to the major depressive disorder, which is very severe form of depression. With the persistent depressive disorder, the symptoms are very mild, and also, aside being mild, it becomes chronic. And with this, it will take about years, or over 2 years, before you can detect or before you can identify if the person is suffering from this persistent depressive disorder. One may ask, what are the major signs and symptoms of depression? Like we always say, depression is irrespective of the person's age or gender. Anybody at all can suffer depression. It is not tied to adults, neither is it tied to children. Any age group can suffer depression. And I will always say, if you can't base on one major symptoms to diagnose a person of depression, but rather we look at several symptoms coming together before a person can be diagnosed as depressive, since it is one of the major CNS defects. With depression, the major symptoms are as follows. One, that is inability to concentrate or inability to perform or complete a major task. That is one symptom. We also have aggressiveness, and also anxiousness, irritability. They are all major symptoms, or they are all major symptoms of depression. We can also have another symptom, that is, when it comes to the physical aspect, we can also have lack of sexual performance, and also we may also have various forms of the symptoms, depending on how it presents itself. And we look at the causes of depression. Whenever a person is depressed, or under depressive mood, we may look at the causes as well as the risk factors for depression. The causes of depression include familial history. If you have a relative, or if depression runs through the family, there is the tendency for you to also develop depression. We also have two, that is early childhood trauma. There are some people who have been exposed to certain stressful events during their childhood days, and as for that matter, they have developed, or they will develop, depression. And early childhood trauma can also expose you to depression. We also have the brain structure. This is more of the brain, that is the frontal lobe, the structure of the frontal lobe. If the frontal lobe structure, or the frontal lobe, is less active, science has also shown that you are more likely to develop depression, or you are more likely to suffer from depression. And also we have certain medical conditions. When you have pre-existing conditions, such as you have chronic pain, you also have ADH, that is attention deficit hyperactive disorder, or diabetes, any cardiovascular disease, you are also likely to develop depression. We also have medical use. Some people just abuse or misuse some kind of medication, which also expose them to this depressive disorder that I'm talking about. And we may also have several forms of causes, or several causes coming into play. Some people may also have some kind of relationship problems. They may also have some kind of, that is, work problems. We shouldn't forget that depression can also interfere with our daily life activities, hence affecting productivity. So once a person is depressed, it affects the person's mood, likewise the person's action, and also the person's body. So depression is a major health issue that should be treated as soon as possible, or anybody who is suffering from depression should seek a health advice rather than delaying for the symptoms to aggravate before attending to a particular clinic or health aid. When depression is left untreated, you may develop this, or you may suffer these complications. One is weight gain or weight loss. It's also another form of depressive complication. Side apart, the person may also have relationship problems. The person may also have panic attacks. And like I told you, depression is a recipe for suicide. So the person may also have suicidal thoughts. Aside the suicidal thoughts, you may also experience what we call social isolation. You see the person becomes melancholic, always sad. And aside this one too, the person may also experience, or the person may also suffer self-harm. Once the person is there, this repetitive thought of killing or harming him or herself may also come in. So once a person is suffering from depression, elsewhere, you see that they take depression, or they take people suffering from depression they take it as a serious health issue. Unlike here, where the person is depressed, the person is just kept elsewhere, or the person is just isolated for some period of time and the person regains strength. But elsewhere, it is treated as a medical issue with medications. So the only advice that I'll give to audience or viewers watching is that once a person is depressed, like I've shown you everything. Once a person is depressed, the best thing for the person to do is first of all visit the nearby hospital or clinic. Once the person visits the nearby hospital or clinic, the healthcare provider or the therapist over there will determine, based on several questions, based on maybe the person's activity level, the person's mood, the person's social life, and also the person's response to his or her questions, will determine if the person is suffering from the major depressive disorder or the person is suffering from the persistent depressive disorder. Aside this, there are several medications that can also enhance the treatment of depression. One, you can also take once you go to the hospital, you'll be given antidepressants to be taken. Aside those antidepressants, you can also be engaged in what? Psychotherapy. The person sees the therapist, maybe through counseling, the person can be put to order so that he or she may not suffer from this depressive disorder. And also, we will also encourage exercise. Once the person, sometimes if we exercise, the reason why exercise is encouraged is that once the person exercises a lot, there is this hormone that is endorphins, which are able to improve a person's mood. So we encourage the persons to do a lot of exercise so that these endorphins can be released, so that the mood will also be improved. And aside that too, we may also advise the person, if the depression is as a result of abuse of misuse of any drug or any medication, the person will also be advised to desist or limit the intake of such drugs. And also, we may also encourage the person to do, there is one thing that we call the white light therapy. The person will be exposed to white light. As the saying always goes, white lights always improve a person's mood. So the advice that I'll give to anybody suffering from depression or anybody having this CNS effect or CNS disorder, that is a central nervous disorder, that depression, the only advice that I will give the person is to first and foremost seek a medical advice rather than abusing drugs, going here and there, resorting to several unprofessional, unapproved, and unconventional ways of treating depression. That is the only advice that I will give to anybody having this depressive disorder. So depression is really a health issue, a mental issue, a mood disorder, and it should be treated as such. So anybody who is having or who is depressed should take it as a health issue and report him or herself to the nearby hospital or clinic for professional advice. So that is the only advice that I will give to anybody having depression or suffering from depression. Hopefully next month we shall bring you another episode as we've been dealing with all these CNS disorders. Maybe we may after treating this, we may also venture into another psychotic disorders, or maybe Parkinson, Alzheimer's, or schizophrenia. So expect much more from DTL World International. Thanks so much for watching. Stay blessed and God bless you.
DTL World TV. Your life is your message.